Slider, Director of Fundraising and Development for Huddle Up Moms. Thank you so much for joining us in our 2020 Roanoke Pregnancy and Postpartum Resource Summit. We're joined today by Mandolin and Mara, who is going to give us an exciting presentation on Beyond Self-Care, Understanding Maternal Mental Health. We will be taking questions, so please use the question and answer, the Q&A feature, to submit your questions. I'll also be keeping an eye on the chat if you have any housekeeping that you need to present to me. So without further ado, please join me in welcoming both Mandolin and Mara.
Hello, everyone. All right, Mara is gonna go first, but my name is Mandolin Restivo. I am the Director of Support and Development for PSVA. And Mara?
And I am Mara Watts. I'm an LPC, and I'm also the Director of Outreach and Education for Postpartum Support Virginia. So we are gonna get started and throw a bunch of information at you all, but the goal here is just that you have just to be empowered to know what the risks are and then to know what to do if anything comes up. Go ahead, Mandolin.
Okay.
So this narrative that this is going to be the happiest time in a woman's life is wholly present in our society. So we just want to be clear about that. What's old narrative? What's new narrative? And here are some of the pictures that we see thrown around to promote what's about to come when you have a baby. And I even remember from my own time having babies, like walking around Babies R Us and seeing all the products and everybody was smiling and happy. And so certainly that narrative does present itself in this time. So we just want to be aware of that. And it might not always, right? There's a lot of duality here. It can be the best time of your life and the hardest time in your life. It has challenges, dishes stack up, all these pictures, the laundry, all of these things. So just want to make sure that we understand that the new narrative is it can be all the things all the time. So perinatal mood and anxiety disorders, or PMADs as we call them, are not as uncommon as you might think. So postpartum depression affects up to about 1 in 7 women. Postpartum anxiety affects up to about 1 in 5 perinatal women. And when we talk about perinatal, what we mean is the moment of conception to the baby's first birthday. So essentially almost a 2-year period. And this affects up to 1 in 2, about 44% of Black women. So we also want to keep an eye on that and some of the disparities that we see here. Perinatal mood and anxiety disorders are the #1 complication of pregnancy and childbirth. So again, just we want you to have all the information to be aware so you can advocate for yourself and have this information, but also you're not alone.
Okay, hold on.
Yeah. Okay, so what do PMADs sound like? Okay, there's a lot of supposed tos or shoulds that we hear from women. This should be the happiest time of my life. I should be happy that I have a healthy, happy baby. Why am I sad? I love my baby, but I hate my life. My marriage can't survive this. Having a baby was a mistake. If only I could get a good night's sleep. I'm having thoughts that are scaring me. Why can't I snap out of it? A lot of women feel like, they just want to put their head down and get through this. And, why can't I just do that? I'm the worst mother in the world and my family would be better off without me. So again, things that you might hear or think yourself or things you hear from friends or family that we just want to kind of keep an eye on. So looking at some of these high-risk populations, so NICU families, up to about 70% of NICU families will struggle with a PMAD. They're 40% more likely to get PMADs, and 25 to 40%, 45% will suffer from PTSD. Military moms, both active and dependent. So about 20 to 50% of military moms will experience PMADs, most frequently during that first 6 weeks. And they did this study of 192,000 military moms and concluded that we need to rigorously screen these women. I'm not sure if that's being done, but that's what the study came back saying. Black or African-American women, nearly 1 in 2 Black women will experience some sort of PMAD, and fewer than half will be screened. That's what we know about what's going on in our country here. And fewer than 20% of those who are screened will be referred to resources to recover. And then when we look at the Latina Spanish-speaking women, up to about 40% of Spanish-speaking women will struggle with a PMAD, but most will never be screened and all face numerous barriers for treatment and recovery. So again, the goal of this presentation is not to be down on all of these stats, but to give you the information you need. And we will give you ideas of what you can do to reach out towards the end. So causes and risk factors, right? We don't know exactly why some women get this and some women don't, right? But we know that it's a biopsychosocial illness. So it's a combination of these factors: biological factors, psychological factors, and social factors. When we look at biological factors, we want to look at your mental health history. So if you have a personal health history of depression or anxiety, then you are at higher risk of getting anxiety or depression in the perinatal timeframe. Again, we don't want to be scary. We want to empower you to get the help and support that you need. Also, if there's a family history of mood and anxiety disorder or a mood and anxiety disorder during this perinatal timeframe, then that also puts you at higher risk. So this is a really good time to have conversations with your mother or your sisters or people in your family about what their experience was like. Also, your reproductive history. So have you had miscarriages? Did you go through fertility treatments? Any sort of premenstrual syndrome, a difficult pregnancy, labor, or delivery? And then hormone changes. Again, we just want to be clear about that is a part of this too. And then general health, if you have thyroid issues, anemia, and then again, lack of sleep. So we know that that's something that comes into play here. Then when we move over to the psychological factors, we're looking at personality and behavior. So are you someone with perfectionist tendencies, self-esteem issues? Difficulty with transitions is also on our list. And I want to say I've not met one person who is good at transitions in their life. So just allowing for that to come into play here. Unrealistic or rigid expectations of what pregnancy is, of what motherhood is, of the work-life balance. Anything like that can come into play here too. Relationship and role issues. So your relationship with your partner, your relationship with your mother. There's nothing like having a baby to bring up some of these issues about motherhood and childhood and things like that. So again, just things to keep an eye on. And then also breastfeeding here, expectations and weaning, etc. And the social factors, we're looking at trauma, right? Because if you have a history of any sort of trauma here, we just want to keep an eye on that too, because you're at risk here for an increase at PMADs. Also social changes. This is a time in life where people have a lot of life changes. So someone gets a new job, you get a new house, you lose a loved one, you feel isolated, especially now in COVID times, right? We're feeling a little bit more isolated. And so just, again, keeping an eye on that. And other issues, including the baby, meaning do they have colic? Are there any health issues that you're concerned about? Financial stress. We talked about a lot of people decide, we're going to get a bigger apartment, a bigger house, and then that causes some issues. And then any sort of low income or immigrant status. We just want to, again, be aware of all of these. And we want you to have this information, again, to empower you and not to be worried. And we'll tell you about the path to wellness down the way here. Okay, so we talk about hormones, and I'm not a doctor, but I am going to look at these graphs with you a little bit here. So on the left, we have this chart that shows as you're going through your pregnancy for those 40 weeks, right? You have an increase of estrogen and progesterone, and you have this dip of the HCG. But at delivery, you'll notice that progesterone and estrogen level drops significantly. So again, we know that this is something that can really impact women. And there's some research and good stuff going on right now, regarding that. But it's a pretty stark chart to look at about that drop. And then on the right, we have what happens with hormone levels of lactation. So again, we have this oxytocin that's going up and down, up and down, up and down as you're breastfeeding or having let down, if that's what you choose to do. The estrogen is increasing at birth, then drops, and then hopefully levels out. And then the progesterone kind of drops off. So again, you don't need to know the ins and outs of this completely, but what we want to know is that this is what's going on in your body. And again, give you the education that these are the ups and downs that are happening as you go. Okay. So this can be a perfect storm, right? Of hormonal changes, sleep deprivation. It's a huge identity transition, maybe the single most in a woman's life. Unrealistic expectations, difficulties in pregnancy or birth, and then a predisposition for depression or anxiety. So again, prior depression or anxiety is the #1 predictor for PMAD. So again, keep that in mind. So this spectrum of mood and anxiety disorders we're going to talk about is we want you guys, again, to have all of this information. And I think a lot of times people talk about, they say postpartum, they mean postpartum depression. Some people have started talking about anxiety, but there's a lot of different things that you can look for here. When we look at mood disorders, what we're talking about is depression and also postpartum bipolar disorder. And when we look at anxiety, we're talking about general anxiety as well as, panic disorder, obsessive compulsive disorder, and then PTSD. So here's sort of our spectrum of disorders, right? So baby blues is super common. About 85 to 90% of women will get the baby blues onset within those first 3 days, and that will resolve within 2 to 3 weeks. So the symptoms are sort of being up and down, lack of concentration, sadness, weepiness, a little bit of anxiety, loneliness. But again, they don't interfere with a woman's ability to function. And that's a huge theme here, right? And the treatment is sleep and social support. Then we have these perinatal mood and anxiety disorders, all of the ones that we just sort of talked about, which is again about that 20% of the general population. This onset is during pregnancy or the first year postpartum, and the symptoms, they look a lot like baby blues with the mood swings and the tearfulness, irritability, feeling overwhelmed, but they will affect a woman's ability to function. And that's when we want people to reach out, because you shouldn't have to deal with this alone without help, because it's extremely, extremely treatable. So with a combination of sort of some self-help strategies, social support, talk therapy, and medication, women get well from this. So again, that's what we really want to make sure everybody knows here. An extremely rare 1 in 2 women out of 1,000 will get postpartum psychosis, rapid onset within that first 2 weeks, and the symptoms are extreme, right? Anxiety, agitation, insomnia, confusion, delusions, disorientation, can be in and out of touch with reality. It is a medical emergency, but again, I want to say that this is treatable, and women do get better from this as well. I know it's scary, but it is treatable. Okay, so partners. Maternal depression is the #1 predictor of paternal depression. So that is one reason why we do focus on moms. We don't ignore dads. That's not what we're doing, but that is one of the reasons why we kind of keep an eye on the mom here. But 1 in 10 fathers will experience PMAD. So the studies suggest they're anywhere in between about 7 to 10% of new fathers, okay? And we assume rates are similar for same-sex partners, but again, there's a lack of research here in this area, so we'll also own that. It increases if the mother is experiencing a PMAD as well. Again, that goes with the #1 predictor up there. PMADs in fathers can lead to an increased likelihood to spank, less likely to read to their kids or be connected in that way. And also can be linked into a drop of testosterone that occurs when a man becomes a father. There's some interesting research out there about that happening about 3 to 4 months postpartum. So really, really interesting stuff, but that can happen as well. Nope, go ahead. So it looks a little different in men than it does in women, but an increased anger or conflict with others, increased use of substances, frustration, irritability, weight gain or loss, isolating from family and friends, being easily stressed, impulsiveness, problems with concentration or motivation, loss of interest in hobbies, sex, and working constantly.
Okay. So now we're going to shift a little bit and talk about the path to wellness. And a lot of these things are just essential for wellness in general, whether or not you're experiencing a PMAD, but in particular, they're very useful if you are experiencing a PMAD postpartum. And so the path to wellness is a combination of self-care and social support are the basis for everyone of self-care. And then in particular, if you're experiencing a PMAD, additionally, talk therapy, medication, and hospitalization. Talk therapy is also really good for you if you're going through a life transition, which motherhood is. And so I'm a big advocate of talk therapy at any time. So self-care, what does that look like? Sleep, 4 to 5 hours of uninterrupted sleep. This is the bedrock of self-care. So I know when we start to hear the word self-care, I think it's become really marketed to us as spa days and bubble baths and going away for a weekend, but we're really talking about what are the basics that we need and deserve as humans. We need to sleep, we need to move, we need to eat, and we need some time to ourselves. So sleep, 4 to 5 hours of uninterrupted sleep. Both partners, if it's a 2-partner household, really do need to get this much sleep. So you need to strategize around how is everyone in the house going to get at least, I really like to say 5 hours because it's a whole REM cycle. So if it takes you 30 minutes to fall asleep, that means you need 5.5 hours in bed, not just 5. And what a lot of if it's 2 people in the home, what a lot of folks will do is split the night. So one partner will sleep from 8:30 p.m. to 1:30 a.m. and then the other partner will sleep from like 2 a.m. to 7 a.m., something like that. So that you're splitting the night and the person who is sleeping gets to put in earbuds and go to sleep. If you are nursing, and you could, generally, I always recommend that moms pump in the morning after they wake up, because your body makes the most milk overnight. And then you can feed the baby and then pump, and you will generally get enough milk for a bottle to be given overnight. And then to sort of sleep at night until your body wakes you up. If your body is waking you up before 5 hours, you can pump for relief and then go back to sleep. But your body will eventually understand that we can go for 5 hours. So it's all supply or demand. So you can kind of train your body for when you're nursing and when you're resting. I'm also a lactation counselor, if that is useful. Since I'm telling you all about this. So exercise is very important. So this means something different to everyone. If you were someone who was used to doing, CrossFit before, so in your first 6 weeks of postpartum in particular, we're not saying you should be going outside and moving tires. We're talking about going for a walk, walking around the block, making sure you get outdoors each day. The vitamin D is good for you. The vitamin D is good for the baby. And so that you're just changing your scenery and you're just getting that light exercise. It's excellent for healing, but you don't want to push yourself too much while you are healing. And then everyone's need for exercise will look different from there as you heal. Some folks are used to, doing a lot of physical exercise, and your body is used to those endorphins. So you're probably going to do more than someone who wasn't doing that before. But finding a way to at least spend 20 minutes a day on movement is really helpful. Eating is also really important. And it's so interesting to me that we have to tell moms, like, you need to sleep, you need to eat, you need to move a little bit. These are just things that we should be doing because we're humans and we're valued enough to do that. So yes, you need to eat. If you are nursing a new mom, when you're nursing a newborn, you're burning in 800 calories per day. So just nursing the newborn, so you need to be consuming at least 500 extra calories per day, which is really a lot of calories. So make sure that you're eating every time the baby eats. High protein, as well as a lot of veggies and fruit, is going to be excellent for you. You can make yourself a little basket, like little baskets around wherever that you nurse, and put a few protein bars in there and whatever kind of snacks that you like, some bottles of water. Staying hydrated is also another part of this. Staying hydrated is super important. And then to make sure that you have time off. If a partner is going back to work, when they get home from work, they can get 15 or 20 minutes to decompress, and then you all can switch shifts. And if you can, leave the house. I know Mara likes to tell people to walk around Target. I happen to not be a Target fan, so I would just sit in my car and listen to podcasts or something. But whatever it is that you like to do that is going to make you feel good, 20, 30 minutes, I like to say an hour, out of the house, away from the baby, just taking time for yourself. It could also look like going upstairs into the bedroom, shutting the door, putting your earbuds in and taking a bath, right? Or just, reading a book. But I do encourage, especially if you've been home all day, if you're the partner home all day, to do leave the house. All right. Anything that you'd like to add to this self-care, Mara?
No, you did a great job. And things are different a little bit right now during COVID. I just want to add that normally my Target prescription is to go out, get a coffee, and walk around. But if that's adding stress to your life, clearly don't do that. But getting away is great. So like Mandel said, going out for a drive, getting a hot drink for yourself, something where you're doing some mindfulness and grounding for yourself in that event is really helpful.
Mm-hmm. Okay, social support is also very important. So social support is looking like it's having folks around you, but it's a very sort of mindful and purposeful relationship. So when you're engaging in social support, you can do that through PSVA support groups, through moms groups, or through just your relationships. it's going to be a combination of getting emotional support. So keeping folks around you who echo that you're valued, that create warmth, nurturing, and caring, show empathy, concern, and acceptance, and provide encouragement. A companionship, it's wonderful to be around moms who have struggled with the same thing. And that's one of the things that our support groups really provide is our facilitators are folks who have struggled with PMADS and have come out the other side. And so you can really see what healing looks like. Informational guidance and suggestions, giving information and resources, speaking from experience. And then also if there's any way that you can get tangible help. Are there folks who can drop off meals? I'm a big advocate of leaving a cooler on the porch and people can just come and put the meals in there so that you can grab it whenever you're ready and you don't have to feel pressure to host. If there's anyone who can help watch older children, if there's anyone who would help tidying the house or just doing some errands, doing laundry. If you have folks like myself and my neighbor, whenever we go to the grocery store, we always text the other person and say, hey, going to the grocery store, do you need anything? Don't say no, say yes, right? If there's someone asking you that you need something, say yes, ask for the milk, ask for the bread, whatever it is that you may need. Because people really do want to be useful, but I think that we're so programmed to want to do everything ourselves by ourselves. And this is really a time for creating community. Folks shouldn't be coming over for baby cuddles. Babies need to be with their parents during these early days. And so they should be coming over to move your laundry from the washer to the dryer or to fold something or to clean something. And so support does look a little bit different during this time. Something else that is really useful, I think it's useful for any time that you're going through a transition, but in particular, if you're suffering from anxiety, depression, or other symptoms during your postpartum time, is therapeutic techniques. And what is really great is that these PMADs are very treatable with short-term therapy. So it's not like you have to go for a year to feel better. You can really start to get some strategies and feel a lot better in just a few sessions. So the types of therapy that are useful are cognitive behavioral therapy, where you are focused on changing your thinking, interpersonal therapy, where you're focusing on relationships, and then mindfulness. My experience is that most therapists, you will use a combination of all of this together. There isn't someone who's like, I just focus on thinking and we're not going to talk about relationships at all. Like, I only focus on relationships and we're not going to look at all at thinking. So all therapists tend to bring these in. If you have had a traumatic birth, or if you have a history of trauma that has come up for you during your birthing process, during your postpartum process, EMDR is a really wonderful tool. It uses like rapid eye movement to help reorganize traumatic memories so that you can process through them better. Again, it's very useful. You can do a lot in a few sessions. Mara, anything on therapeutic techniques since you are the therapist?
No, you nailed it. I mean, I think what you said is perfect. You can go to a therapist and say, hey, I have 4 sessions. I have enough money. My insurance covers 4 sessions, or, and a good therapist will be able to do good work in those 4 sessions with you. So just wanted to highlight that. And you had said that. So just wanted to make sure that that's out there. But yeah, I think there's a lot of work you can do very quickly on these things.
Mm-hmm. Okay, some folks do need medication, and medication can be safe during pregnancy as well as for breastfeeding. And so sometimes what happens is when a mom becomes pregnant, her OB may even recommend to stop taking medications. And then what we're really talking about is increasing that mom's risk. So we really want to think about a risk analysis versus a risk-benefit analysis when we're thinking about medication during pregnancy and postpartum. So there are significant risks to not taking medication, especially if you were taking medication before pregnancy. So really finding a therapist, a medication, someone who prescribes medication, a psychiatrist or other provider who understands in particular pregnancy and breastfeeding. We do have a number of resources on our website, which I'll show you all at the end of this slideshow. So that is super important, and it's a big myth that you can no longer take medication once you become pregnant, as well as breastfeeding. Lots of moms are very worried about taking medication when they're feeding the baby from the breast, when you're feeding your baby your own human milk, and there really can be safe. A lot of OBs will also, like during postpartum, just be like, okay, we just give everyone Zoloft. And sometimes that works great, and sometimes it doesn't. So it really, really is useful to see a provider who really understands these issues. So some tools and techniques. One thing to think about, to be sure, is that to really reframing self-care as not a luxury. We're not talking about luxury things. We're not saying to go out and buy a Cadillac so that you feel good driving around. If you can and that works for you, great. What we're saying is to sleep, eat, move, and have some good social connections. Those are really things that are just essential to the condition of being human. And I think that as moms, we just put ourselves so low on the ladder that we don't care for ourselves in the way that we really should. And right, it's super cheesy, but you can't pour from an empty cup. You really do need to care for yourself first. So starting each day, like, what are 2 things I can do today to take care of myself to be a better mother? So one of the things we did at one of my support groups recently was we thought of things that you can do to take care of yourself in 1 minute, 5 minutes, and 10 minutes. And that ended up being a really nice exercise. The things that people came up with were drinking water, making tea, and sort of that felt like a big ritual for some folks, the making of the tea, the holding of the warm cup. Some mom said that she started just squirting herself with her favorite perfume in the morning because that just really made her feel cared for and feel good whenever she smelled it. And then, of course, the 10 minutes was more going for a walk, listening to music you like. It doesn't have to be baby shows and baby music all day long. It's not actually what's best anyway for kids. Kids, it's wonderful for them to hear different vocabulary and be exposed to different types of music. So you can really play music that you enjoy. You can listen to podcasts or news stations that you enjoy, and that's just good for the household. And again, exercise, nutrition, and sleep. Okay, so really coming up with strategies for each of these is really wonderful. And high protein, you can eat a high protein diet even if you are a vegetarian. And I know folks who have been a vegetarian for a long time are really good at this, but sometimes if you're newer to vegetarianism, it is a bit harder. So things like beans are excellent sources of protein. Even adding like quinoa to your diet, that can really help. And again, the strategies for 5 hours of uninterrupted sleep. How are we doing? Do we have questions or anything coming up in the chat? No, I guess not.
None so far.
Okay, feel free to drop those questions. Okay, so some other coping tools. If you're feeling like you're having a lot of anxiety during the postpartum time, our brains are wired to be anxious. We are sort of always looking out for what are the risks for this baby and how am I going to protect this baby? And so it's very adaptive that we become more anxious during the postpartum time. But then what happens sometimes is then we can't start to differentiate between high risk and low risk. And so everything seems like a huge risk. And so one of the things that is really useful is to really think about, okay, what is the worst case scenario here and how would I deal with that? And then what is the best case scenario? And then to really ask yourself, if I'm really being honest about this, what is most likely to happen? And that can just reframe your thinking. You've already thought through what is the worst thing that could happen, and you have a plan so you don't feel unprepared. You've already imagined a really good thing happening, so your brain is prepping for that as well. And you become really honest with yourself about what's the most likely thing that can happen. Sometimes folks will become really anxious about bathing the baby or walking up and down the stairs with the baby. And so thinking through those things in a realistic way can really just empower you to be able to do those day-to-day tasks. Really thinking about anti-catastrophic thinking. So really thinking about whatever are the things that you're worrying about, how likely is this really to happen? And talking with someone else about it is really useful. So, and even if you don't have anyone else to talk to, start to reframe it. If a friend told me this, what advice would I give them? And really examining how likely is it to happen? What if it does? How will I handle it? And really trying to apply to yourself the same grace and empathy that you would be giving to a good friend. And then just thinking, really being aware that, as we said before, being anxiety and worried about the baby is very adaptive. And so, sort of like a master mindfulness techniques is like thanking your anxiety. They're like, wow, thank you, anxiety, for helping me see things in this way. You've done your job, right? Like you can be done now. And that can kind of help you move forward, because so often our instinct is to try to control these emotions versus acknowledging them and moving through them. And so this anxiety it's playing a role. It's helping you be a better mother. Maybe it's just, it's like Hulk anxiety right now, and we just need it to go back to being regular worry. And so thanking it for its extra work and then moving through that can be really useful. Some other great practices are progressive muscle relaxation. So a lot when we talk about mindfulness, I'll have to say it always comes around to breathing and things like that. And I have realized that for me, if I'm feeling very stressed or very triggered, the breathing and the progressive muscle relaxation, those things don't work for me. So I'm just going to say that first up. I will say what works the best for me is something that really helps me become physically aware, physically present in my body. And I have to say, I learned this from Mara. Opening the freezer and sticking your head in it is the most impactful thing for me personally, because it's a very physical thing. And so I realized that I'm that type of person. Like if I'm doing exercise, I want to be lifting really heavy weights. If I'm, I always am tending towards things that are much more physical. And I can talk to people about breathing all day. I talk to my doula clients about it. We use it during birth. But me personally, like a therapist recently recommended to me, like, well, have you tried breathing through this? I'm like, yeah, I know all about breathing. Not my jam. I don't do it. The other thing that is helpful for me is like making a fist and shaking my hands, or taking my hands and pressing really hard on my thighs. Those are all things that like just force me to be grounded in a way that I wasn't before. So I just like to lift that one up first, because I think for people who aren't like a breathing type of person, it can start to feel like, well, this mindfulness stuff doesn't work for me. So a thing that is really useful for many people, though, is this progressive muscle relaxation. I do find this very useful when I can't sleep. And I've even taught my son to do it when he's having a hard time falling asleep. So if you're laying in bed, you're going to work through tensing and releasing all of the muscles in your body. So tense up your feet, release them. If you're pregnant, don't point your toes because you'll get a calf spasm, but you can just focus on tightening up your lower legs and releasing them. Tighten up your thighs and then release. And really squeeze your muscles as much as you can and then let it go. I tell my son to say, like, thank you, toes, good night. Thank you, legs, good night. I just squeeze and release. And I think like, oh, feel myself melting into the bed. And that's really helpful. And then squeezing your arms and releasing, even squeezing your face and letting it go. And then thinking about your tongue getting really plump in your mouth. That will really help you relax and could be a nice ritual for when you're going to sleep, to really, get all that tension out of your body. For breathing is just breathing in for 4 and breathing out for 4. The type of breath I like the best is actually if you breathe out for longer than you breathe in. So if you breathe in for 4 and breathe out for 6, it actually can get your body out of fight or flight mode. So that is a very useful one. If I'm going to breathe, that's the one that I use. Finding a mantra. I am good enough. I am okay the way I am. I'm a good mom. These are just feelings. It's okay to feel, right? Those are all nice mantras. And then we talked about finding ways to be physically present in your body. Stick your head in the freezer, shake your hands, run your hands under cold or warm water. Those are all things that are really useful. And then tapping, you can look up some videos on YouTube on how to do it. It's anything that engages both sides of your brain is going to be really great for grounding you. And so tapping, there's different points where you tap, and there's a sequence of actions that you do, and that can be very grounding. There's also, if you have like a music player subscription, you can listen to, there's music that plays, you have to listen to it in a headphone, but it'll play in one side and then another side. And that's really useful for grounding you. It can be great for sleeping. So any thoughts on these, Mara?
No, you did a good job here too. I mean, I think the only thing for me that's really powerful is this sense of smell. So using an essential oil has been really helpful for me. So I think sense of smell is powerful. Taste is powerful. So eating a little piece of dark chocolate, getting back into your body, or citrus, something that has a strong taste to it. And then I also think anything grounding or mindful, like you can do that in any activity that you're doing. So I know that for me, something powerful has been doing sort of like a body scan when I take a shower. So like feeling the water on my head, on my shoulders, on my back, on my legs. And some showers, I don't do that. I hop in, hop out. I have 10 minutes. I got to get in, I got to get out. But some of them, when I really need some self-care, is doing the body scan in the shower, using the good lotion, taking care of myself in the way that I would take care of my kids, right? I slow it down for them. I'm going to slow it down for me. I'm going to take good care of myself. So those are some ways you can do some of that self-care grounding as well.
Yeah, I always do also find a cup of tea very grounding.
Yes,
like it's a little bit ritualistic, and then I do just enjoy holding the warm mug. There's just something about
there's
that.
Something about it. The taste, you're bringing smell, you're bringing, change of temperature. That's a really good one too. But just slowing down what you're doing just a little bit. And I think you can add the mantra to that too, which is you deserve this warm cup of tea, because you're doing a great job and you're handling it, something like that. So I think you can combine all of those things. It's something that works for you.
Perfect. Okay. So that's all. I am going to pull up our website so that you all can take a look at all the various things that we have for you. Okay, sorry, I should have had it up, but I didn't. But I'm enough in this moment. It's fine.
You are.
Totally am enough. We can also get an iPhone 12. Okay, so we have a number of things going on. We have right now all of our support groups. Come on, website. All of our support groups are virtual. And we have them almost daily. So Tuesdays, Wednesdays, Thursdays, we have so many groups that you can attend. So I've had a number of moms that have called the warm line and I've been talking with, and they have committed to attending a group 3 times a week. And they're just popping into different groups because they're finding that social and emotional support really key. We do have groups in Spanish in case that is something that you would need, or someone who would need that. And then we have a few specific groups. So we have a breastfeeding support group that's run by an IBCLC, Kristen, who's on our staff, our Spanish language groups, a group for military moms, a group for those who are NICU families, and then moms who are currently expecting. And that one is just so we can process through. We started it because folks were really nervous about birthing during COVID, but I think it's just a nice way to meet other pregnant folks and talk about some of the fears and anxieties and hopes that are coming through. We also do have a warm line that you can call. So I want to go to our resources during COVID-19. So we have a warm line. That's the number right there. And another thing that I think is wonderful that we have is we had done this Real Talk series. And so we have all of these slides and or recordings available for you. So you can take a look at overcoming anxiety, how to talk to kids about the COVID-19 pandemic, information on breast and chest feeding during COVID-19. The trauma and resiliency with Danielle and Mara is really great. That's where I learned about sticking my head in the freezer. And asking a pediatrician is also wonderful. So I would highly recommend at least the overcoming anxiety and the trauma and resiliency. Those were really wonderful. And I've been in this field for a long time and still picked up on new skills just watching those. And then we also have a number of providers who are providing teletherapy. All of the therapists on our website have been specifically trained to treat folks who are experiencing PMADs. And then we also have, we do have providers who are also medication prescribers. So, all right. Anything else you'd like to add, Mara, just about this?
I think the only thing is if you have any questions at all, ever, even if it's just like, is this something I should be concerned about? Please call us, reach out to us. We can always talk anybody through what to look for or a plan or go through these grounding exercises again. So please do not.
And you can also text this one line.
Yes.
Mara and Mandolin, thank you so much. We have no questions that have been submitted, but I'll give another opportunity to our attendees if they want to submit anything in the Q&A feature now. Please feel free to do so. Mara did it.
Awesome. Yeah. We can start a head in the freezer movement. Yes.
Do it. It works.
It's bad, just put your head in the freezer. Everything will get better.
It works.
It really is amazing.
All
right, if anybody out there has even anything that you do for self-care, we'd love to hear interesting, like taking care of self ideas. All right.
Thank you both so much. This was a very beautiful session. We really appreciate you taking your time to present to us, and to our audience members, thank you so much for joining us. We'd like to thank our summit sponsors, Dr. John Harding and Star Lactation, for their support in our Roanoke Summit and for supporting moms in the Roanoke Valley. We want to let everyone know that all of these sessions have been recorded, and we will be putting them onto our summit website after the summit ends today. And we would like to wish everyone a wonderful rest of their day.
Great. Thanks so much for having us.
Thank you so much. Our pleasure.
You guys were fantastic. Thank you so much.